Have you been told that you need a very large, open lumbar fusion involving an incision 6 to 8 inches long in your lower back, and that your condition will require you to stay in the hospital for at least 3 to 5 days, that you will have to donate blood for a possible blood transfusion following your surgery, and that after it's all done, you're going to need a back brace for at least 3 to 6 months? Then I would encourage you to seek a second opinion from a spine surgeon who can offer you a minimally invasive lumbar fusion. In fact, minimally invasive lumbar fusions can be done through multiple incisions less than the size of your fingertip. These minimally invasive operations accomplish the exact same thing as an open surgery, but without muscle cutting, without bleeding, and with a lot less scarring and no need for a back brace. In fact, most of these minimally invasive lumbar fusions can be done as an outpatient or with a quick overnight stay in the hospital. And none of them require any back braces to be worn after surgery. If you don't believe me, you should listen to one of my patients. He was told by 3 different spine surgeons that he needed a big, open, multi-level lumbar fusion. Fortunately, I was able to address his spondylolisthesis at 3 levels with multiple small incisions less than the size of my fingertip. Why don't you listen to him during his first post-operative visit?
Feeling very well. So this has been a long recovery for me, long journey in general. Little backstory. I originally fell in 2006 in the United States Navy. I fell about 20 feet, landed in the sitting position. Over time, just everything kind of healed in the wrong way. Last Easter, though, is when I fell only off of a 4-foot platform, changing a light bulb, and that sort of just ruined everything in my spine from the lumbar to the cervical. So what I did was finally had enough to where I couldn't handle the pain anymore. I couldn't hardly walk. It affected a lot of the spinal cord, the nerves going out. My arm, if you'd have seen me a year ago, I was laid up like this in a chair and barely could get up and walk. So I decided to make the commitment to pursue spine surgery. Did my homework, a lot of research. I didn't rush it by any means. It took me about 3 months to determine who I was going to choose. Came across Dr. Kern Singh, heard about all the great things that he's done in this field of expertise, all the great reviews and the success stories in his patient field. So I made the commitment to come here and started meeting with his physician assistants, and then filling out all the questions, really getting to the root cause of the problem. A lot of MRIs, a lot of CT scans, but we did it the right way, the right plan of attack, put together an actual game plan, and now here I am, roughly about a year and a half later, and 100% healed. It's only been 6 weeks after the lumbar fusion, and I can honestly say I'm pain. They asked me today, what's your pain level in your lower back? 0. What's your pain level in your neck from when I had the lumbar or the cervical? It's 0. I have full use of the arm again. I can get up, I can move it around, I can walk without problems. What I keep catching myself doing now is I'm standing up at an event, or if I'm at a checkout line, I keep wanting to find a chair to sit down after 5 minutes, but I don't need to do that anymore, and it's bizarre to me. I bought a standing desk, so now I'm actually standing for about 45 minutes. Before I came into this road to recovery, I couldn't even stand for 2 minutes without literally like lightning pain down my legs, just pulsating in the back, things like that. So Is it worth it? Absolutely. I do encourage you to do your homework, take the right route. But if I had to recommend anybody, it's absolutely Dr. Kern Singh and his team, and you will not regret it, and this will be the best thing you ever did in your life, trust me.
It's amazing what can be accomplished with a minimally invasive lumbar fusion. In fact, most patients can't believe that they're only 1 or 2 weeks out from surgery when they're outside walking with their dog or their family. So, before you undergo that big open lumbar fusion, I would recommend that you get a second opinion with the spine surgeon that focuses only on minimally invasive surgery.